let's talk about rhinoplasty. Many people in the world, in Europe, in the US, are in a kind of controversy and say that contrary to breast implants, rhinoplasty has much more evolved in the US than in Europe. It's very interesting to get a cross vision of this situation between US and Europe, thanks to our two participants today, which is Dr. Olivier Gerbault, you're a plastic surgeon from Paris in France, and Dr. Calvert, you're a plastic surgeon too from Beverly Hills, Los Angeles in the US, one of the greatest locations in the world to practice, I think, such surgery. Let's start with you, Dr. Calvert. In your region, where demand must be very important, what do patients want exactly? What are the goals?
Well, what people want now is a very natural result. They are looking for a nose that fits their face the best without looking done, without looking operated. And that's become sort of the buzzword is, I want a natural result.
And before talking about techniques to reach that, just to have an idea, what are most popular noses?
Well, the most popular noses people will bring in if they want a very natural looking result is Angelina Jolie. They would bring her. If they want a more done look, they'll bring Sienna Miller. Some will also bring in Ashley Simpson, where the nose looks very much like her own, but it's really changed her look very significantly.
So you're in LA, you must know Angelina Jolie and all these stars?
I don't know these stars myself. I certainly know their pictures because many of the patients bring them.
It's enough for you to have pictures to work. Okay.
You bet.
So now let's talk about, not a controversy, but a discussion about your techniques, the evolution of techniques and practice between the US and Europe. For example, Olivier Gerbault, would you say that the evolution has been very different between Europe and the US?
Well, now, not now, but the birth of rhinoplasty is in Europe, and the first technique has been done in Europe a century ago. The thing that has changed is the concept of rhinoplasty has changed. I have learned, rhinoplasty, but which were resection, reduction rhinoplasty, where I've been taught to remove cartilage, to remove bone, and I had no control on what the nose was becoming. And what has really changed, and this comes from the US, is to control. It's kind of a structural rhinoplasty, what you put graft inside, grafts that don't show, but inside, and sutures to reshape your nose and controlling exactly how your nose will look like after the operation. So this is a main change, and this change has come especially from the US.
So you were the inventor in Europe, but the US made the great change. Now you control noses, all the noses you do, Dr. Calvert?
Well, we definitely like structural rhinoplasty. We want to see that the result that we achieve on the table really stays with the patient through their life. And as Dr. Gerbault refers to these structural techniques, these are the best ways to give a better result over time, which is what patients want. They don't want it to look great the day the splint comes off, and then 2 years later they need a revision, which has been the case prior to really 1986 and 1990, where some big advances in grafting came. And now those advances are being adopted worldwide, but as all things in medicine, it takes a long time before it's accepted by the surgeons across the world.
By the way, do you think it's worldwide accepted in Europe, in France? Did you make such progresses? You don't have secondary rhinoplasty or less than before?
No, there are still lots and lots of secondaries because it's quite long for surgeons to change their habits. And when you've been taught to do always the same, to do a closed rhinoplasty and to resect, to remove and try to reshape only by removing, it's very difficult to shift to this modern rhinoplasty. So I still see lots of secondaries. I think Jay does also, but maybe surgeons that are more educated in the US and they are in Europe, but it will change, of course. I used to have, when I was resident, when I was chief resident, at the end of surgery, those piggy noses, or after the surgery, those drooping tips that I couldn't have any control on it. And now it doesn't happen because I want my nose at the end of the operation to be exactly how I want it, and it won't move. It won't move with time. This is the main thing.
Rightly, how can you be sure that it won't change, it won't move? Because before you didn't know. You, I think, were one of the top specialists of grafting something special. How do you do?
Well, what you're referring to is the dice cartilage and fascia grafts, which I think has given a lot of control to the way that the bridge looks, and that has been the biggest problem over time. Is how can you determine that the bridge will not change with time? And really, there's no way to know for certain. Rhinoplasty is a specialty that really requires you to understand that the nose will change with time. So with that said, these grafting techniques with dice cartilage and fascia, with the Collier-Meller struts and spreader grafts that Dr. Gerbault is speaking of, these grafts really do give you more predictable results, but it is not a guarantee.
Not a guarantee. Would you say that any woman or any person in this case will come back once in his life, even if it's 10 or 20 years later, to make another nose or to come back to you?
That's an interesting question. I think that the percentage of people that have secondary rhinoplasty, if the primary is done well, then the chances of them needing a secondary is very low, maybe on the order of 5% over a lifetime. However, if there are problems and they need a secondary rhinoplasty, then the chances that they'll need a third or fourth operation begins to go up much higher.
Last question, a little provocation, but do you think that we can trust you, French surgeons, or do we have to go to the States to be operated?
No, I think there are some very good French and European surgeons in rhinoplasty. Thing is, you know, in France and maybe like in the US, this is the most difficult operation in aesthetic surgery, and this is operation where there are the most often commonly redo operations and the highest rate of insatisfaction. So it's really a very tough operation, and lots of surgeons, as I do now, really specialize on it. And as Jay, I mean, he doesn't do only rhinoplasty, but most of his activity, as most of mine, are focused on rhinoplasty. And the main word is experience. You can obtain experience by doing lots and lots of rhinoplasty, understanding rhinoplasty, analyzing, knowing how to analyze a nose, and then to use those modern techniques we were talking about. And it's not like in breast implants. In breast implants, you say to women, you'll maybe have to come back because of the device failure. Here, we want all to have the perfect result at the first shot, at the first operation, and so it's really related to the surgeon experience. I don't know what's the thing about.
Yeah, I agree. I mean, I think in terms of, you know, do you have to go to the U.S. for a good rhinoplasty? No. There are wonderful surgeons around the world, and we see them at congresses like this one, where everyone is interested in getting better results for their patients. And really, when there are surgeons in every country that are coming and learning these techniques, those are the surgeons that you're looking for, the people that are the best and have the most experience.
Thank you very much to both of you. I remind Olivier Gerbault, the plastic surgeon from Paris, and Dr. Calvert, plastic surgeon from Beverly Hills in the US. Thank you.